In last month's edition of the American Veteran, we visited the Women's Clinic at VA's Medical Center in Martinsburg, West Virginia. We return there now to find out more about how VA is adapting its health care services to better meet the needs of this growing population of veterans. As you'll see, a lot is changing.
Veteran Joanne Nicholson gets her care, from basic checkups to GYN exams and breast cancer screenings, here at the Martinsburg VA Medical Center in its Women's Primary Care Clinic, a facility with a unique feel and purpose.
I'm Joanne Nicholson. I have a 2 o'clock appointment.
Okay, Joanne, you can...
As you come in, you have the receptionist, who is a woman also, and pictures of women in like military service. And a little booklet talks about women's services that are available.
Female patients place importance on different things than male ones. Here, from the warm, homey decor to an all-female staff, everything is done with women in mind.
I like being able to go to the women's clinic and to be seen by a woman because there are gynecological services and you feel more comfortable discussing those things than you would with a male doctor.
Clinic designers attended to every detail, down to the pretty pink ribbons on the gowns. The room layout is especially important. Unlike the rest of the medical center, each of the rooms has direct access to bathrooms, more privacy, and top-of-the-line gynecological exam tables and equipment.
We also schedule women differently. We give them a longer period of time so that they can spend more time with the women's health provider, because women, I think, really value the communication and the exchange with their provider, so we make sure we build that in.
With the advent of these clinics, female veterans no longer need to go outside of VA for any of their care. Dr. Habte is these patients' primary care physician.
We work hard to make sure they know they are appreciated in the VA system. And by having this clinic, by starting the Well Woman Clinic, they have something they can call their own. Now we'll do the pelvic exam.
The doctor cares for the whole woman, focusing her full attention on each patient's health, making sure every potential issue is addressed.
I really like interacting with the women. And when the woman comes to the clinic to the visit, it's not just to come get the medical care and go home. It's to vent, socialize. So as we go along, we get to know each other, and it's easier to relate.
Hi, Ms. Nichols.
Hi, Dr. Habte.
And the extra time and soothing setting pays off for her patients. Joanne, a former military police officer, is battling PTSD, the result of combat in Iraq.
PRRC program is very good. So I thank you for doing that initial referral. It is through the women's clinic that I was referred to get my help. So I'm also very thankful of that too.
Dr. Habte referred Joanne to another new program, group therapy designed specifically for female veterans.
I had the potential of being in a situation where I could become upset, and I had developed a plan.
Through the mutual support of women with similar experiences, Joanne was able to cope with her combat-related trauma.
In terms of mental health then and mental health now, it's day and night.
Joanne has come far since her initial diagnosis, now expressing her painful journey through painting.
The teardrops represents the sadness and the depression that I had when I first arrived here. The American flag represents my pride in having served my country. I can't get that peace again.
During our visit to the Martinsburg Women's Clinic, we learned that as more women veterans enter VA's healthcare system, they can expect more programs to be designed specifically to meet their needs. To gain more insight into the types of VA services available to female vets, go to the Women Veterans Health Program website at www.publichealth.va.gov/womenshealth.